Health for All, that's the theme for this year's World Health Day, observed every year on April 7th. It's the World Health Organization's brainchild aimed at discussing health-related issues globally. I'm joined now by Dr. Phatho Zondi, the COO and Clinical Lead at Unu Health, to discuss South Africa's health and wellness ranking. Doc, thank you so much for your time and good morning to you. Perhaps let's talk about the importance, first of all, of access to primary health care for all, and this speaking as well to the theme of World Health Day, which is health for all.
Absolutely. Good morning, and thank you for having me. Just in terms of the topic that you've asked me about, which is the importance of primary health care, we know that we currently globally face a health crisis caused by numerous factors. But I think the one that I want to concentrate most on today is this growing burden of non-communicable diseases. So these are diseases of chronic lifestyle and lifestyle-related diseases. It's a global problem, but certainly Africa right now, unfortunately, seems to be winning this race of this global burden of disease. And so I think on this particular World Health Day, that's what we should be paying attention to, is how do we make healthcare accessible? How do we make primary healthcare accessible? How do we make medical and lifestyle interventions accessible to all so that we can start to overcome this growing burden of disease?
And speaking of those, non-communicable diseases, Doc, I mean, the impact that unhealthy choices can have on one's susceptibility, I suppose, how big is that impact?
Oh, it's significant. I mean, if we just think about the burden of disease in Africa, firstly, 50% of all deaths in Africa are attributable to this non-communicable diseases. Diseases of chronic lifestyle contribute to illnesses like cardiovascular disease, hypertension, diabetes, certain cancers, stroke, mental health disorders. So, I mean, the impact is broad, the impact is deep, and the impact, however, is also largely preventable. And this is why I think it's a good topic to focus on, because there's much that we as individuals and certainly as society and a medical community can do about it.
When we talk about young children and we talk about their development, I mean, what are some of the developmental benefits of adopting and nurturing a life which is indeed centered around, health and wellness, and not just only something to think about when one is in their adult life?
You raise a really important point that many of the interventions that we know are helpful in terms of maintaining and sustaining health are ones that should be introduced very early in life. So we're talking about things like regular exercise, like a balanced diet, like good sleep habits, right? Like good social support. And all of these are fundamental in terms of a child's development and health. We know that something like regular physical activity as a young child, and here we're talking about just free play, unstructured physical activity, every single day as a young child will help with musculoskeletal development, will help with neurodevelopment, right? Will help with cognitive development. We know that children that are physically active tend to do better at schools. They can concentrate better, they have a better ability to absorb information and retain information and learn and grow. Of course, things like diet are also fundamental. And here we're not talking about fancy diets, we're just talking about a balanced diet, a good combination. Simple carbs, some protein, and some good nutrients and fats as well. So these are all principles and really basic and fundamental principles that, if instilled from early childhood, would improve, obviously, prosperity, development of children.
Right. And over time, I mean, I suppose as you grow older, it can better be beneficial to one's performance, lifestyle, mental well-being, and avoid the quick, a silver bullet or help me, get energy quick, like your energy drinks and your coffees. But if over time you develop those habits, Doc, I suppose then you will see better performance and better mental well-being.
Absolutely. And the challenge that we have, as we become older, and I guess as we become adults and we have competing interests and very many pressures, that we start to compromise on certain things. And I mean, the first things that we compromise on certainly are exercise. We start to make quick choices like your diets and unhealthy choices, and very much we compromise on sleep. And I mean, even if we just focused on these three very factors, getting enough sleep, making sure that we eat a balanced diet, and of course building in just little forms of exercise during the day, we would perform much better as individuals. We would perform much better as a community, of course, within our family settings. We would start to thrive.
Yeah. I want to go back to, diseases and talk about how significant early diagnosis is, as well as early interventions, I suppose, in helping better to manage, to cure, to treat those diseases.
Absolutely. I mean, Dumela, I mentioned when we started that we face a health crisis, and specifically just zoning down in Africa. And one of the largest barriers that we do face is resource constraints and access to medical care. So one of the reasons we face a health crisis is that people are not able to get to the care that they need when they need to, or when they get there. And so that when they get there too late, essentially. The challenge with late diagnosis is that by the time that an individual does start medication or start their medical care, essentially, they're already suffering complications of that illness. And so something like prediabetes, which is a leading cause of illness and then death, specifically in Africa and amongst women, something like diabetes, one can pick up diabetes or risk for diabetes in the pre-diabetic stage. And at that particular stage, lifestyle interventions can prevent the onset of overt diabetes mellitus. Diabetes, as we know, can cause complications, can cause kidney complications, it can cause heart disease, it can also lead to susceptibility of stroke, and so on and so forth, very many others. And so the importance really of early diagnosis, and there's a number of ways in which this is being tackled now, through technology as one, which is fantastic. But the importance of early diagnosis is that you can intervene at an earlier stage and prevent complications of illnesses.
Yeah. Just lastly, before I let you go, I suppose, putting in these two questions together, you touched on technology, and I wanted to also just elaborate on the role tech can play in further ensuring that there is primary health care for all, that it is accessible to all South Africans, but also, Doc, I suppose, reflecting on the 3-year anniversary of South Africa's current health status post-COVID and particularly lockdown.
We know that COVID had significant implications or consequences when it comes to health because people moved a little bit less. And obviously, itself being an illness, it affected people in terms of their health profile. And so 3 years on, we really need to be proactive in terms of how we start to address that and overcome overcome the consequences of COVID. Technology plays a crucial role, Dumela, in making primary healthcare more accessible, particularly in areas where there is a shortfall of healthcare workers or limited access to medical facilities. So platforms like Unu Health and many others that bring people closer to healthcare, that bring people closer to quality healthcare, to doctors, to medication, to pathology, will play a significant role as we look forward to bridging the gap of that exists in healthcare.
Well, I appreciate you, Doc, speaking to us about this. Also, given that it's a Good Friday, it's Easter Friday, we might be binging on some mini salads that we shouldn't. So it's good that we did this bright and early in the morning so we can just set the day on a good note. But I appreciate you speaking to me, Doc, and happy Easter to you. Thank you so much for joining us, Dr. Phatho Zondi, COO and Clinical Lead at Unu Health, talking to us there about World Health Day and I suppose the theme being health for all. That's speaking to access to primary health care, and that should be accessible to all.